Before we start the episode, this is for the doctors listening. If you treat personal injury patients, you will be asked to defend your records. Depositions and subpoenas are not a possibility, they're inevitable. On February 13th and 14th from 9 to 11 a.m., we're hosting a virtual training seminar called You Are the Expert. We train physicians how to document, prepare, and testify with confidence before an attorney or insurance carrier ever questions your credibility. Register now at pisciences.com and click the banner at the top of the page and enjoy the episode. Welcome to Injuries and Evidence Podcast. My name is Dr. Brandon Carter. I'm your host today, and I have a co-host with me today, Jason Wardell. It's great to have you here.
I'm happy to be here.
Let's do this. Today we're going to be talking about the upcoming You Are the Expert virtual seminar. We're excited to have it. It's coming up on February 13th and 14th for just 2 hours each day, just 9 to 11. You're not going to want to miss it. Actually, it's going to be like Freaky Friday, Friday the 13th. And then it's going to be We Love You on February 14th.
Sharing the love.
Share the love. And if you have not registered for that yet, please register for it. You do not want to miss out on it. It's going to be like one patient visit. That's all it's going to cost you. And it's going to be the best. We're going to be covering a lot of information from documentation to depositions. It's going to be our big focus. And then we're going to be talking about CVs and expert witness, because it's not if you're going to be deposed, it's when. I promise it's when. In fact, this morning I was marking on my own CV another deposition. And it was one of the craziest depositions that I've been in, where the defense attorney dug into, the case was like 6 years old, and the attorney digs into my records, which is the focus. They don't care about who you are and I don't blame them. I would do the same thing as a defense attorney. They don't care who you are as a physician. They do care a little bit about your credential, of course. That's important. But they're not going to focus in on that for the most part when you've had so many depositions such as I've had, and when you're so involved in personal injury. And he digs into the deposition side, and he starts digging into my examination. Oh, sorry, I said digging into the deposition side. He digs into my examination side, and when we're getting into the exam and the details of it, he starts realizing that 6 years ago, this was actually a very severe injury with disc herniations and how it's wrecked this guy's career. And the patient's career, he was a soccer, he actually was like a college level plus into professional level referee for soccer. The guy was awesome with soccer. And it had pretty much ruined his career as a soccer referee because he had this low back injury that was so bad. And, so I think the attorney started realizing on the insurance side, he's going, hey, I wonder how he's doing right now. And he ends up inviting me to do another examination on him. Can we get an updated exam, Dr. Carter? Is that be okay? And I'm going, holy crap. I've never had anybody invite me to do an examination. Give me an updated exam. Now, I've had it from the plaintiff side, who's trying to kind of protect their client in a sense, but I've never had the insurance side ask me for an updated examination. And so I was a little, that was the first time out of all the years in practice and deposition and expert witness work where I didn't know how to respond to the defense attorney. I'm thinking to myself, yes, is my answer yes, or is my answer no, or to get an updated exam? Or maybe it's it depends would be my answer.
That's funny.
It was so weird. So anyways, we're excited to have this You're the Expert training coming up. And because every doctor that works in personal injury, if you have not had any preparation for depositions, you really have no clue what's going on with it. Don't just risk it. Yeah. Don't just kind of say, I don't know, I think I could do it. Heck, I got a call over the weekend from a friend from Hawaii. Aloha. We love Hawaii. We need to get to Hawaii. He actually invited us out there too. So he's like, hey, come out anytime. He's on Kauai, and it's beautiful weather there right now.
It's beautiful weather there every day. Well, maybe they get snow up on the top of the volcanoes there.
Yeah, it is beautiful weather. Yeah, so he called and he's like, "Hey, I have a friend who was in a car crash and he went to the ER. It was just a couple days ago. What do we do?" And it was like,
Mind you, that was also a doctor who called you saying,
"Yeah,
"What
it
do
was
I
a
do?"
doctor. Yeah, he was." Yep.
But that's not
And
the
he
first
called.
time we've ever experienced that, because we've had ER surgeons that are medical officers. They've called because they did an exam. They're like, "Wait, what do I do here?" We've had physical therapists, like owners of multi-clinic chains, and we've had a very similar conversation. Like, how would you diagnose this? Because we see their diagnosis and it's 2-3 diagnostic codes. It's like, well, let's look at number of regions. Yeah.
Well, and not let's not forget, as we're talking about depositions, is that I just spoke with a law firm last week who said that right now they are coming down. They're deposing medical doctors. They're deposing PTs. They're deposing. It used to be kind of like just the chiropractors because for some reason, it's like they just figured perhaps that they're just not as experienced or overbilling or overtreating or something like that. It's flagging the account. And
Are they looking at specific things when they are going into deposition? Is it just diagnosis and documentation, or is it like billing practice as well? And
they're going to do both.
okay,
Yeah, they're
so
going to hit
really
your bills.
It's across the board.
They will hit your bills, and they're going to go through the entire itemized statement. They will. They're going to dig into anything they could find to discount your credibility. And so if they could find that one little thing, then they're going to use that as in deposition. They're going to use it against you as a non-retained expert. I wish that everybody would realize it. Like, for some reason, everybody that practices in personal injury, see, this is the part that I don't get, is like all the doctors and all the chiropractors that want to get in, and physical therapists and MDs, and they want to get into personal injury right now, which is amazing, and we want that. However, and we're seeing these huge companies, right, that are expanding and growing, and
Bringing on doctors.
and they're bringing on doctors that have no clue what they're doing. They don't have any idea how to document. They have no idea what the process is for a personal injury case. The minute that you sign that day one exam, you are a non-retained expert.
You can get pulled in.
You could be pulled in deposition. Your records are going to be subpoenaed, and you're going to be scheduled for a deposition. When they notice that you are a greenie, kind of like a rookie, and you have no idea what you're doing, then a great defense attorney will do that. And I've met some amazing defense attorneys, and they have done phenomenal jobs.
Honestly, there's like real beauty in the craft of providing a very sound cross-examination.
Yeah.
From a defense
Yep.
attorney. It's really, really good. Like seeing how that's structured and put together, because really they are trying to find, hey, is there something that is not accurate? They're trying to define and show and see, is there real merit to this being hocus pocus? Or not even just hocus pocus, but is this even worth what it's supposed to be worth? And having a defense attorney that really knows how to walk through that and look at those aspects of a case, it's very impressive. Like, it's definitely a skill set.
And it is a skill set, and that it always comes down to the experienced ones, and you could tell the younger defense attorneys, and it's because of that cross-exam process, how they are with you. I've had some guys that are right out of school, and you could tell they were just hired on by Allstate or State Farm, and and they're in the deposition, and they're very soft with you, very friendly. It's like and then you can tell the ones that are really good, that really know what they're doing. And the sad part is a lot of defense attorneys they'll drag you down a road that they should be, they're trying to impeach you from the case. That's really their goal, is like get you out of that, impeach you from the case. And that's their job, and that's what they're hired on for. However, some of them go down roads that, it's just not fair. It's like, you shouldn't be asking that question. Like, for example, and I think we'll talk about this, You Are the Expert seminars. Like, I had an attorney pull up a picture of me and my son, and we were hiking a canyon, and it was actually in a courtroom as an exhibit. And he like holds this picture up, and he's like, "Dr. Carter, can you tell me who this is in the picture?" I'm like, and I had no idea that picture was even going to be coming up. So there's times where they're going to pull some fast ones on you, and you got to be prepped. And if you're mentally not ready for that as an expert, and he pulls it up, and then the opposing counsel says straight up, like, "Objection, Your Honor, this is totally irrelevant." And the judge was like, "Okay, agreed," just sustained or whatever. And he just agreed with the plaintiff that it was like, why was he going to share that? I mean, why he pulled that picture off the internet, off of like the like my Facebook page or something like that. And I said, and I think in my Facebook page I said something about I think in my comment or something under that picture, it was like, "We hiked this canyon today. This was amazing. I'm so glad we didn't get injured. So for all you personal injury patients," it was something it was like a kind of a marketing line that I had used or something. And I think that's why he was going to share that. But, so you never know what they're going to do, right? So they'll dig your entire life out. In fact, one attorney, defense attorney, after a deposition, or no, before the deposition, he said, "I know more about you than you know about yourself." It's kind of creepy, man.
Presumptuous.
It is presumptuous, and it's creepy though, because they're just trying to make you. And he says, "Off the record."
You got a fangirl.
I do. They love.
He's just obsessed. Probably has a massive cardboard cutout of you, like sitting in his office.
Well, and again, you got to go in unbiased, right? So I'm unbiased. I some of the defense attorneys I've gotten to know well, and they're very comfortable with them. Understand? I know the direction they're going to go, and I know how they work with me, and it's just your job though, as an unbiased practitioner, is to go in and explain your medical records.
Yeah.
And so what does that tell you? If you're going to explain your medical records, you better be good with your documentation, right?
Well, you better know your documentation.
Begin with the end in mind.
Yeah.
We always say that. Begin with the end in mind. So this You Are the Expert deposition seminar is really a kickoff, because we'll be doing it more, but it's this time each time we're gonna focus on something very specific, and it's gonna be a surprise.
Can I ask a question? This is down like funding group route. Do funding groups need to be concerned about increased deposition and profitability of cases? Because do poor depositions cause loss of revenue, like reductions of bills if the doctors depose horrible, or
I would say
they don't perform well in court, or they don't understand what they're doing?
I think
or their documentation's bad.
I think most personal injury practitioners would agree with that. That it does. I mean, if you cannot explain that your treatment was reasonable and necessary with each treatment that you provide for that patient, if it's not documented well, then why not?
Yeah, they can really
then a funding group, and there's tons of funding groups, right? And they better make sure that their practitioners are well trained and understand, document the A to Z of personal injury.
Yeah,
and what they need to be, what their documentation, how it needs to improve with their documentation. The great thing is nowadays we have AI systems that can help with our good software programs that'll discuss functional loss with that patient, and per visit, and so there's a lot of software out there. I mean, I was just listening to one the other day, and sounds like it's a great software program that if you're going to do PI, you better be ready for this stuff and not just use cookie cutter stuff, because that's the other thing they're picking up. I mean, imagine what the insurance companies, with their money in their scans of records and stuff, they are flagging doctors with AI now as we step into that era. So you better be ready.
Yeah.
For deposition.
And there's also deposition software that attorneys are using. So in cross-examination and just record review, what are the weak points? What should they focus on? What should they highlight? Like, what direction should they take? They're using deposition software to support them in that. I'm excited because we actually have a software provider, an AI deposition software provider, who's going to be presenting. We'll have more info on that. But they're going to be one of the presenters in this to educate on what software are they up against. Like, how do doctors need to prepare because of the software that's coming out, the change in environment.
Well,
we host this podcast for the love of personal injury. If you love PI and want to help our mission, share this podcast with a friend or on social media. Also, don't forget to check out www.pisciences.com for upcoming training and education for legal professionals and physicians who practice in personal injury. Now, back to the show.
Imagine if companies like that, I mean, if they're, again, our training with physicians, it's our goal is it's ethics first, it's unbiased opinion, right? And as an impairment examiner, and it's just when we focus in on deposition, it's always the defense that's going to be going after you, unless you're hired on as an expert, not a non-retained expert. If you're hired, and I've had those questions thrown at me, like, how many times have you been deposed or on the defense side versus the plaintiff side? And it's like, well, most often the deposition is from the defense because I treated the patient.
Yeah.
So now you become a non-retained expert for that patient. So of course the defense is going to be coming after you. They'll ask you those questions. They'll say, give me a percentage. I want to know. Or how often are you treating patients? I want to know how many hours a week you're working. I want to know how many, it's like they want us to keep track on, I don't know, some kind of a booklet that I'm sitting here every day going,
Dear diary, I worked on 85 patients today.
I know. So you're going to get questions like that at you. Don't stress over them. Just do your best. Answer the best. Just be honest with that stuff.
Yeah.
But when it comes down to the documentation, that's a whole different world, right?
Still be honest with that.
Better be honest, because it's written right there.
Very clear in your documentation.
Clear. And that's what we're going to go over.
So it's almost like pre-deposition. What do you need to prep in your documentation prior to even going into court? But once you're in court, what kind of questions are going to be thrown at you? What do you need to prepare for? What kind of steps a framework of preparing for deposition?
Good.
On the legal front, from CV to actual questions to reviewing of your records to what are they going to be throwing you questions about? And then how should you respond? What are very savvy ways to respond to cross-examination and questions from defense?
Great point. And they will review that CV. If your CV is 1 page long, and that's all you've been keeping track of. I mean, nobody ever sat down with me and said, hey, 20 years ago, said, hey, Dr. Carter, if you're going to do PI work,
here's a CV, and this is how you need to structure it.
This is your example of a CV, and it's structured this way, and I want you to keep track of it like a journal for the rest of your life.
It's like a resume, really.
It is like a resume?
Very structured living resume.
Well, and I've heard guys, though, it's like a resume, but it's your journal of your life, of your career. And because there's some guys I'm hearing that have 100-page CVs.
Ooh.
Because they're tracking all the seminars they're going to and training, and they put it in the CV. So that's stuff we're going to go over with You're the Expert. So it'll be it's stuff that opens up your eyes, and you realize if I'm going to be in PI, if I'm going to go down this pathway, then you better be ready.
I love it. So doctors, if you are looking for joining this and you want to excel in your depositions, go to www.pisciences.com, and then up at the top there's a banner. It's You Are the Expert. So / You Are the Expert. Or you just hit the banner and register there, and it takes you to a landing page where you can get more information and then register for the event. One thing, we are doing it virtual, which is different because we've done in-person seminars.
Yeah.
But we're getting doctors from Colorado and from Nevada, Hawaii, and Florida who are jumping on this, and we're like, well, it's not really working for in person. So we're just going to do it virtual. We're going to record the whole thing so you'll have access to it and all the downloadable material. It's all going to be available for you.
Well, as we grow across the United States, I mean, it's just going to have to be a virtual setup, with every clinician. It's going to be awesome. It's actually going to be a lot of fun too. So that's one thing we were working on, because I don't want you sitting there just drooling, falling asleep. It's going to be interactive. We're going to have some games going on, and it's going to be pretty cool. It won't be just bingo, I promise. It's going to be other games. But bingo may be an option for this one. We'll see, because there could be a prize.
Set up like a virtual bingo card.
It's virtual bingo, and then whoever gets it then wins a prize of, I don't know. Maybe we'll give them a digital inclinometer, because nobody's using those.
Cool.
I think it's a great idea.
That would be sweet. Range of motion testing. If you don't know what a digital inclinometer is.
Yeah, not a lot of guys are using them still. You still don't see it on documentation.
Is it mainly visual?
But there are, or they use like goniometers maybe,
Okay.
but mainly visual.
Yeah.
There's they're not doing, like, if you're going to do an impairment exam, you better do the flexion 3 different times and document that you did that. So, I mean, it's there's so many different things that I use a digital inclinometer to evaluate, because we need to check and see if it's greater than 5 degrees per every time they do a flexion, is it within 5 degrees of each other? Otherwise, you got to throw it out. And that's stuff you got to be ready to testify on in depo. But again, not a lot of guys know that stuff, and I didn't either. So many years ago, and I struggled. I mean, I just went through the refiner's fire.
So this virtual seminar is really to cut 20 years of learning for doctors down to like 4 hours.
Totally.
And 400 plus hours of expert witness and trial time. 400 plus, I think, for you right now. And it's really taking that, compressing it into 4 hours and saying, hey, here's the highlights. This is how you can go. So it is February 13th and 14th, 2 days. It's just from 9 to 11, and it's going to be recorded. So if you register, you're going to have access to the recording. And then we're going to be sending out those links virtually. So,
and plus, when you sign up, they get a bonus.
Ooh.
And they get the bonus
the
A to Z.
Yeah.
In PI.
Yep.
For legal and health professionals. And so it's about an hour-long training that you can have for your office staff and everyone that's involved with your practice. And that way you're not having to do all of the explanation of how personal injury works. And it's free. That's like $1,500 video right there. Training program.
Cool.
For free. On us, because we love you.
It'll help with
Because it will be Valentine's.
Yeah. That's our gift of love to you.
There you go. Happy Valentine's Day.
And if you don't have a Valentine's date, you can register at pisciences.com and you can join us. I like that.
I mean, you're good looking, Jason, so let's go.
No, you're good. Well, we're both good looking. We're turning into aged cheese right now.
What was
wine and cheese.
What was that doctor calling me on
Gandalf.
over the weekend? Gandalf, that's what it was. He's like, "Oh my gosh, Dr. Carter, you look like Gandalf."
I did have a beard, and then my wife was like, "It's too pokey.
Lose it.
Got to get rid of it.
Lose it."
Yeah.
That's why you buy the beard butter.
I know. I do have beard butter, but she just doesn't like how long it gets.
And you got to go to Live Bearded. Hey, anybody that has the beards, go to Live Bearded and get that beard butter and the oil. It's like the best. It's so good.
Well, we'll see you guys on February 13th and 14th. Not guys. We'll see everybody on February 13th and 14th for You're the Expert. From exam room to courtroom.
Exam room to courtroom. We'll see you there.
Okay. Aloha.
Have an awesome day.
Thanks for listening to Injuries and Evidence. If this episode added value, subscribe to PI Sciences and grab our free gift, a 60-minute training called A to Z in Personal Injury. It includes all the tools we use every day to strengthen documentation and improve case outcomes. The link is in the show notes. Use it. Don't leave value on the table. We'll see you on the next one.